Hello, my name is Kelly, and I'm a nurse here at Transcend Health Solutions. We are a clinic that was built to specialize in treating patients who have proven to be treatment resistant, as well as patients with significant trauma and those who are struggling with suicidality. The purpose of this video is to tell you why Transcend should be your go-to referral site for ketamine treatment in Austin and San Antonio, and to inform you of who an ideal candidate for treatment would be and when it might be the right time to consider referring a patient to undergo ketamine treatment. It is important to note that we are not a clinic that just administers ketamine. We are one of the nation's leading providers of ketamine-assisted psychotherapy. Integrating psychotherapy alongside IV ketamine infusion increases the efficacy and durability and is a critical component, particularly in patients with a history of trauma and those who are suicidal. This is why our success rates hover upwards of 83%. We wholeheartedly believe that it is unethical to administer ketamine to patients who have a significant history of trauma and not provide psychotherapy and substantial support during the process. The vast majority of clinics in the area operate this way, and we highly encourage that you do not advise any patient to go anywhere that does not fully integrate psychotherapy into the process. This can cause harm and at best will only provide transient symptom relief versus long-term changes. So who's an ideal candidate for ketamine-assisted psychotherapy? Patients who have tried multiple medications and psychotherapy but are still having significant symptoms, patients with a significant history of trauma, patients with suicidality that is severe but not quite severe enough to warrant an inpatient admission, patients with personality disorders, patients who have not responded to Spravato or had failed ketamine treatment at a clinic that did not integrate psychotherapy, and patients who are considering referring for TMS or ECT. Some of the most common diagnoses that we treat successfully include treatment-resistant depression, mood-stabilized bipolar patients, PTSD and CPTSD, GAD, OCD, postpartum depression, borderline personality disorder, and patients with a comorbid chronic pain diagnosis. The main patient population that is contraindicated for KAP are non-mood stabilized bipolar patients still having manic symptoms and patients with psychosis. We treat patients as young as 15 years old as well as adults and geriatric patients, and we also have the ability to treat medically complex patients that may not qualify to receive ketamine in a private practice setting. With assigned ROI from the patient, we believe it is important to keep the psychiatric provider in the loop of the patient's progress. This comprehensive treatment is crucial to the holistic care of the patient and is an important factor in the success of their treatment. Lastly, we are always seeking reputable psychiatrists and clinicians to whom we can refer our patients for medication management, as well as refer those who call our clinic that are not eligible for KAP but are in need of other mental health treatment. Please let us know if you'd like to set up a phone call with us to discuss a specific patient that might be a good candidate, or if you would like us to send you literature related to ketamine treatment, or have any further questions about our process. I hope we can connect soon and have a great rest of your day.